Morning, everybody. I want to start by thanking all the sponsors and also especially Geshe-la and Bhaskar and for inviting me here. It's really wonderful to see a group of volunteers coming together and working so hard and so enthusiastically to put this conference together. And you all have done a wonderful job of making us feel at home and been very, very hospitable. So thank you. So I want to start by making it clear that I'm not a scholar like Geshe Dorje Abdullah, who has had 20 years of monastic study and experience. Along the way I've picked up bits and pieces about Buddhism. And I was a clinical psychologist, but now for several years I'm not a practicing clinical psychologist. Yet I think my purpose here is to share what little information I have and hopefully get you to interact with me and that it provokes discussion. So I'm just curious, how many people in the audience are psychotherapists or psychiatrists or involved with a mental health professional? So we have actually a whole family, a husband, wife, and their father, all in Guwahati. Anybody else? So that's it? No other psychotherapists are involved with psychology or the Department of Psychology? Okay, so how many students of Buddhism or practitioners of Buddhism? Okay, so we have a few. So let's see whether, and then we have scholars here, so I'm going to use all of you, hopefully as we go along. So let's start by first looking at what Buddhism is and what psychotherapy is. So as we know, and we discussed this yesterday, we talked about Buddhism being an instrument to study the mind. The focus of Buddhism is definitely in terms of understanding the mind. As was expressed very clearly, the mind is the creator, the mind is the forerunner of all things. And all our problems, as a psychologist and a clinical psychologist specifically, when I look at suffering, the main area that suffering comes from is from our mental states. So problems originate from negative actions, and we're going to talk about this more. So practicing Buddhism is a way to overcome unwanted suffering, or to deal with, or to have a framework or understanding of how to approach suffering. And it is a 2,500-year-old tradition. We have people like even Lama Yeshe who talked about, yesterday we were talking about, it's not enough to just know theory, but it is also important to have an experiential wisdom or an understanding that is grounded, if you will, in practice, so that we bring the two together. And Buddhism involves a very systematic method of training and studying the mind through logic and reasoning, as we talked about yesterday, plus faith. So then, what is psychotherapy in contrast? If you look at psychotherapy emerged from the Western context, and it's very much in its infancy. It's about 300 years old. And when you ask the psychotherapist, so what brings somebody to psychotherapy? Very often it's a person who is in distress, who has been struggling with their issues or problems and does not see a way out and is looking for help. And the psychotherapist attempts to offer ways to kind of overcome some of the struggles that they are having, whether it's with positive thoughts, positive feelings, or relationships, looking at relationships in a constructive manner. So in general, it's not which particular psychotherapy is better. There are many psychotherapeutic approaches. It's really what the client believes would work the best for them, and also having a relationship with a therapist that has the best positive outcome. So if you look at the literature in general, it says psychotherapy is effective. On the other hand, some of the disturbing trends that we notice in the last couple of decades is there's an increasing use or reliance on medications. Partly, of course, it's the pharmaceutical industry. And I think both psychotherapists and Buddhists would agree, while medications has a role or has a place, the over-reliance on medication is certainly detrimental.